So I will move on to House Bill 5162 by Representative Bennett, Chairman Bennett. This is regarding business and professions, regarding physician assistants. This will expand the rights of physician's assistant with regard to the practice and will prohibit non-compete clauses that exceed 5 years with regard to the purchase and sale of a practice. We have verbal testimony from two people and written testimony from 6. Representative Bennett, if you would, please introduce House Bill 5162 to the committee.
Thank you, Mr. Chairman. Physician's assistants have come a long way in the last decade. They were more or less as an RN would be. But through advanced education, they've become a lot more expertise on the general practitioner of taking care of us. What this act would do would allow charitable and voluntary care to allow physicians assistants licensed in the state to provide free care without collaborating with a physician. What this means is they'd be able to go in and help in different situations, such as now with the COVID. It would allow their experience to go in and clear students, let's say that are hurt in sports. They'd be able to go in and assess them, let them know if they need to come out of the game or go into the game. There's a lot of different areas where they can come in and do a lot of help. Physician's assistants are commonly seen in doctors' offices. They come in all different types of fields. I work with psychiatric physician's assistants, but there's different fields. I think this is a bill that's needed. Our physician's assistants work very hard. They go to extensive education, and I feel this is a good bill, and I'm hoping the committee will consider passage. Thank you.
Thank you, Chairman Bennett. Are there any questions from the committee for Chairman Bennett? Hearing none, we will move to our virtual witness. Thank you. Hello, Mr. Carney.
Hi.
Mr. Carney, this is Representative Casey. I'm Chairman of the House Health and Human Services Committee. We have you before us testifying on House Bill 5162. If you would keep your commentary brief. Representative Bennett has introduced the bill. You have the attention of our committee. Please go right ahead.
Thank you, Chairman Casey and members of the committee. I will be brief. I have submitted written testimony that goes into detail. So what I'll try to do here is just kind of summarize what the major points of the bill are. I want to say at the outset that we will be asking for a sub A on this bill. On page 2, line 2, at the end of the line, we need to strike the word and replace it with or. That was something that was just kind of an oversight in the original drafting. This bill will amend a couple of things. It will amend the TA Practice Act. The first thing it will do will be clarify the definition of collaboration by adding statutory references, and it will emphasize the role of physicians in determining the degree of collaboration. We think that it's going to make the overall definition stronger and a lot easier to understand. Second thing it will do is allow PAs to, or clarify the section of the bill that speaks to PAs providing care in charitable and voluntary situations. When the bill was originally amended in 2019 to add this section, the language that we're proposing be added into it was left out of the original original section amendment in 2019. So all we're looking to do is just put this language back in, or put it in, this whole section makes sense. Right now, it really doesn't say much. We're also going to be adding a new section. It'll be section 29. This will be a prohibition on non-compete clauses in physician assistant employment contracts. This is the same language that appears in 5-37, the Board of Medical Licensure and Discipline law. So it will provide the same protection for physician assistants as it does for physicians. And the last two things that the bill will do, it will amend 1691, which is the School and Youth Programs Concussion Act, and similarly 1619.1, the Sudden Cardiac Arrest Prevention Act. What it will do will be allow PAs, and in the Concussion Act, nurse practitioners to evaluate and provide clearance for student athletes to return to participation. And interestingly, Rhode Island is only one of 4 states in the entire country that restricts the return to participation, the evaluation and return to participation to physicians. All the other states allow PAs and nurse practitioners to do it. And in the Sudden Cardiac Arrest Prevention Act, that is basically the same thing. It will allow PAs to provide an evaluation and clearance to return to participation. Interestingly, on this bill, when it was originally drafted, they included nurse practitioners, but they didn't include physician assistants. Not sure how that happened, but we would appreciate if physician assistants were given the same privileges as nurse practitioners and physicians on this. As I said, I submitted written testimony that goes into detail, but I'm happy to answer any questions that the committee may have.
Thank you, James. Are there any questions from the committee at this time? Hearing none. James, thank you very much for your testimony. We're going to move on to our next witness. Hello, Mr. Quinlan.
Yes.
Hi, this is Representative Casey calling. How are you today?
Good. How are you, Representative?
Good, sir. If you could turn down the device you were previously listening on, we're going to get a little feedback from that. And
yes.
Representative Bennett has introduced...
Let me just turn that off.
Okay.
Yeah. How are you, Representative? Turn down the device. Yeah.
Yes, so Representative Bennett has introduced House Bill 5162. If you would go ahead and give your testimony. We've heard from one other witness who is in favor, and you are the last to testify.
Good, and I'll get you out of here quickly and get you back home. So thank you, first off, to Representative Bennett for introducing this bill and for working with us so closely when we did the PA bill just a few years ago. Jim Carney, who just spoke, has done a fantastic job on covering the points in the bill. I don't need to repeat what he said, but what I want to recommend, I look at it this way. This bill levels the playing field. I don't think the legislature intentionally put in nurse practitioners and not PAs, or PAs and not nurse practitioners in the bills that are before this committee. So I would ask that you look at this carefully, but I also ask that you pass this bill with the amendment that Jim pointed out. That was just something that we had to clean up from the original passage, and I believe it's already been submitted. So, again, thank you, Representatives and Chairman, for staying so long. And as I said to your predecessor committee, the HEW committee, you know, the mind can only absorb what the butt can endure or the seat can endure. So thank you all for staying so late to hear this. And if you have any questions on this, my information, I did submit my information to the committee if you have any questions for me or Jim. And thank you again.
Thank you, Patrick. Are there any questions for Mr. Quinlan at this time from the committee? Hearing none. Thank you, Patrick. I will just go ahead and read to you the names of the the entities that have submitted written testimony on House Bill 5162. They are all in favor. There's Craig Belial, the Physician's Assistant Faculty from Johnson & Wales. Christopher Ferreira, a PA, Director of Ed at Bryant University. Ariana Africo, she's a Physician's Assistant at Hasbro Hospital. James Carney from the Rhode Island Academy of Physicians Assistants. James also gave verbal testimony. Mark Bialik from the Rhode Island Academy of Physicians Assistant. He is the Executive Director. And Samara Nasrallah, she's a physical assistant and a Rhode Island Hospital employee. All of those people are in favor of the legislation. We have none who have proposed any written testimony against this bill. So with that, I will, Representative Bennett, do you have any other closing comments on this bill? Hearing none. I'm going to close the hearing on 5162.